Hi everyone, I'm Nikitha Anand of third year BDS studying in RV Dental College. So I'll be talking about the modified Bars technique of brushing, which is the most effective method to remove plaque and food debris from the teeth surfaces. So before that, let's see why brushing is important, what kind of a toothbrush to use, how much toothpaste to use, and how often should you change your toothbrush. So to prevent caries, we have to remove plaque, which is a transparent layer of bacteria present on the teeth surfaces. So the best way to do this is by brushing twice a day and flossing at least once a day. So apart from preventing caries, it also helps to keep the gingiva healthy and prevent periodontal diseases. So, what kind of a toothbrush to use? So, the American Dental Association states that we have to use soft bristle toothbrushes because hard bristles and overzealous brushing or overpressure during brushing can cause wear of the enamel and the gingiva. So, a soft bristle toothbrush with angled or multi-layered bristles helps an excellent clean without harming your teeth. So, how much toothpaste to use? For adults and children above 3 years of age, dentists recommend a pea-sized amount of toothpaste, and for younger children, a rice-sized smear of toothpaste should be used from when the first tooth erupts until the age of 3 years. So, how often should you change your toothbrush? So, the Center for Disease Control and Prevention states that the toothbrush should be changed every 3 to 4 months. But if you notice wear in the filaments of your brush, if there's a lot of wear and fraying of the filaments, that means it is time to change your toothbrush. So now I'll be talking about the modified bars technique and how it helps in effective cleaning of the teeth. So before going into the technique for the modified bars method of brushing, I'll be telling you about the different types of brushing techniques. So the first one is horizontal, in which there's a reciprocating or a scrub technique. The second one is vibratory techniques, in which there's Bars method, Stillman's method, and Charter's method. The third one is vertical sweeping, in which there's rolling stroke, modified Bars, modified Stillman's, Leonard, and Smith-Bell, which is a physiological technique. And the fourth one is the rotary or the Phones technique. So let's go into the method of modified bars technique of brushing. So the things to avoid while toothbrushing is scrubbing back and forth, because this causes a lot of tooth wear, gum recession, and sensitivity over time. And not to use white circles, as this leaves a lot of crevices behind and there may be lodgement of food debris. So the first step to remember in modified bars technique is you have to angle your toothbrush at 45 degrees to the smooth surfaces, and the bristles should face the gum tissue, and use a gentle vibratory motion. So this vibratory motion is a short back and forth motion with strokes in a slightly circular manner. So after the vibratory motion, we do a thrust or a sweep in the occlusal direction, that is away from the gums, in an occlusal direction. So this helps to dig the plaque out of the crevices and the interdental spaces. The thing to remember about this is only 2 to 3 teeth should be done at a time. So after you finish three teeth, then move on to the neighboring teeth, and it should be done one arch at a time. So this method can also be called as the ABS method, that is angle your bristles, vibratory motion, and then sweep away from the gums towards the occlusal surface. For the inner surfaces of teeth, the same method is used. So angle your bristles towards the gums, use a vibratory motion, and then sweep. For the occlusal surfaces, a short vibratory motion can be used. So the advantages of the modified bars technique of brushing are: it helps to remove soft deposits from cervical areas, excellent sulcus cleaning, good interproximal and gingival cleaning, good gingival stimulation, that is, it helps to massage the gum. So for good oral hygiene, don't forget to brush twice a day and at least floss once a day. Thank you.